Hey, girls.
How are you?
Good morning. Yeah,
Good
doing good. How
morning.
are you?
Good. Good to be
Yeah,
here.
awesome. You know what? We're so lucky to have you online today. Let me just wait to a couple people. Yeah.
Yeah.
So, yeah, you know what? I'll introduce you guys, okay? So we can
Awesome.
get started.
Perfect.
Um, So they help occupational and physical therapists with treatment tips and detailed documentation skills. And I believe that documentation is one of the most important things. I know in the beginning of my stroke, I had professionals do it, so I didn't have to worry about it as much. But yeah, it's so amazing what you're doing. And so now we'll go ahead and welcome the Note Ninjas. They're the founders.
Hi, everyone.
Hello.
So I'm Nicole. I'm an occupational therapist,
And I'm Stephanie. I'm the physical therapist.
and we're the Note Ninjas.
Yeah. No, it's so great to meet you. My name is Pat, by the way. Yeah.
Yes, it's so nice to see you in person.
Yeah, no,
Yes.
no, it
Oh,
is.
virtually.
Yeah. I was curious, what got you guys started doing it?
Yeah. So, Stephanie and I actually worked together in a kind of like outpatient or in the home setting with older adults. And we were working together for years and we took on a lot of students and new grads. And they all seemed to kind of have the same questions regarding different treatment planning and documentation. And documentation was always a really big struggle, especially when you're documenting under like Medicare and other insurance policies. So it's a very, detailed and involved. So we kind of just started posting on Instagram some tips. And we found that there was a really big need outside of just our inner circle of students and new grads, that there was a ton of other therapists out there that struggled with documentation and specifically skilled documentation. And then, of course, like, treatments and the like how to document that specific treatment.
Yeah. Oh, that's so awesome how it started like that. I feel
Mhm.
like, yeah, I was always curious about how it all started. And I know you guys have a ton of good reviews from therapists, just how you make their life so much easier. I could only imagine how long it takes, to do all that stuff. So having those tools are just so awesome. Yeah.
Yeah, it was especially like in the beginning, like we were doing a lot of research ourselves and we just couldn't find what we wanted that we knew would help other therapists. So we're like, well, we need to create it. So we did.
Yeah. And even like the treatment ideas too. Like it's hard to find. Sometimes you just get stuck on what to do and you're doing the same things. And you want to use evidence-based research. You want to find things that work for people. Somebody that had a stroke, you want to make sure you're using the right evidence. But it's hard to stay on top of things when you're working 40 hours a week and treating everybody. So to have something available that people can, what's out there right now and easily go to and find and not constantly be, on the research articles and this and that is, I feel like, helpful too.
Oh, big time. Yeah, I remember watching your stuff in the beginning and I took a lot of your ideas and I loved it. Yeah. Especially I think it was one that it was like reaching behind your back. I know you tied some cards like behind the back and so I was doing that one. That's
Oh,
the
great.
specific one I remembered.
Oh,
People
we're
love
Yeah,
that.
no.
yeah.
It's funny. A lot of people like have commented, and we have so many like reviews
Yeah.
and stuff on that one.
I know we never knew too that like we had people that had a stroke or had other conditions that like that followed us too. So like hearing from you and other stories, like people are actually using our exercises and treatment ideas. Like it's just like it's really cool. It makes it even better because now we can help not just like the immediate patients that we used to see in person, but now just like people worldwide, pretty much.
Oh, yeah, I'm so glad that I can tell you guys that too. So, do you have any specific tips for anyone who has had a stroke or neurological injury? I know you have a ton, but maybe you could share one.
Yeah, so I mean, we always, like to personalize care. So I think that's just like so important that like it's not a one size fits all approach. And if you're currently in therapy, make sure that you have a therapist that really listens to you and understands your goals and your needs. Because if they're just, making every single goal the same for all their patients, like they're not personalizing and individualizing the care. So it's really important to have that personal touch from your provider. But one of the strategies that I like to use with a patient who say has one side that's affected is I love mirror therapy. So, having them do an activity with a mirror nearby, that way they're able to visualize and see the movement of the affected extremity. So that's kind of like one of my go-to for treatment if it's appropriate. And you could do all sorts of tasks. You could do fine motor tasks. You could do like some, functional, like putting on tops to containers, playing cards. Really, like, there's no limit on what you could do with that. Some people think, oh, you only hold like a weight and go back and forth or something, but there's just so many ideas that you could do. And you want to make it, once again, personalized to the patient. So, maybe they're a card player, so incorporate cards, or like incorporate their favorite snack they want to be able to open, things like that. That's my tip.
And then also just making sure that you stay like more like higher intensity. Sometimes we're just sitting down and doing like leg kicks or I don't know, different kinds of things. But the more higher intensity, even if it's not done completely correct, you need to get that in there because you need to like retrain those pathways and stuff. We need to be doing the more walking, the stairs, the carrying heavier objects, like really testing ourselves. And even if you're not in therapy anymore, going to the gym or having like a gym in your house or just something that you could constantly be, really keeping yourself motivated and doing those higher intensity things, not just like the really basic exercises.
Yeah, I think just keep yourself challenged.
Absolutely.
If it feels
Yeah,
hard, that's good. That means you're going to make progress, and just keep going.
It's really the same with everybody too. If you're
Hmm.
just doing the boring exercises, you're never getting better. Like you
Exactly.
gotta do the things that challenge yourself and really add that extra into it.
Hmm.
I love that. Along with the mirror, I do like to do it in front of a mirror because sometimes when you're looking at yourself, you can see if you're doing it right or with good form. And then, as far as challenging yourself, that's a good one because I had to build myself up. I noticed I kind of get used to it. And then after a while, I got to push myself a little bit more. And as I do that, it changes things. So I love those two
Yeah,
tips. Um,
for sure.
yeah, thank you, thank you. Another question that I had was, as far as in your profession, is there any type of misconception or common misconception that you wanted to share?
Yeah, so I I'll focus kind of more about like the treatment. So I think a lot of people in like as a OT or PT, they think that they have to constantly come up with like new treatments, new things, new interventions to do. And it's always important to stay like with the research and stay up to date. But a lot of the times it's more just about like how you're progressing in activity. So, you could take a simple activity such as a ball toss and you can progress it in so many different ways and make it creative, tossing the ball towards a target or standing on a foam balance pad. So, from a patient perspective too, it keeps it more entertaining and, keeps them motivated too. Because once again, we're adding on that challenge. So I think, yeah, just a misconception of that treatment planning has to be super difficulty, that we're always having to come up and reinvent the wheel. When really you can just start with that basic activity and then progress it from there and come up with like those new creative ideas to go about it.
I think also a lot of sometimes therapists they'll discharge a patient like earlier than they have to. A lot of people they don't know. Yeah, as long as you're showing your skill, we're technically allowed to see patients for as long as is necessary. We just can't be doing the same exercises every time or giving the same assistance. If you're changing it up, if you're modifying, if you're doing different things, and if somebody's not progressing, but they could like go back, there's also maintenance. Like especially if you're using Medicare and other insurances, could be a little different. But as long as you're showing your skill, you don't have to always be making the progress. You can go on more of a maintenance program. Or even if you're motivated on your own, you can go to the PT and or maintenance program maybe once a month and have your program progress, see where you're at, progress it for the next month if you're going to the gym or working out by yourself, if you're able to do that. Like you can, so that way you still have that person overseeing it, which could be helpful for a lot of people. Sometimes you get nervous or you're not totally sure, but that is an option. And a lot of people, I think, overlook that.
Great, great. Thank you. Yeah, so I wanted to leave it open for any questions. If anybody wants to ask any questions, feel free to throw it in the chat.
No, I
Um,
saw there.
Gigi Gang 2 says, what's a challenge exercise to do for coldness in the arm post-stroke 1 year?
Hmm.
Oh,
How about even like we were saying, like the mirror therapy,
Hmm.
even if you can hold something or something like heavier on your arm, maybe using more of like a heavy load, or if you could put maybe even just getting your shoulder working with like a weighted vest or something. I like heavy loads if you can hold, or
Hmm.
do something that can
Or
attach
build
to
up
it.
to it. Yeah.
Yeah.
Good question. Let's see what else we got. Somebody had
Awesome.
asked. Can I regain hand movements after 3 years of non-use condition? Yeah, I mean, I think anything is possible. It's always going to be on a, depending on the patient and your motivation and what you're doing.
But yeah, I
Um,
mean, in the beginning, it's definitely the easiest in the beginning. A lot of rapid things happen. But
hmm.
if you're using the right techniques, you're using the intensity, you might need to try different things. Try them here, try the high intensity, try constraint induced, all that kind of stuff. But you definitely can change your brain pathways years after.
Hmm. And I see. Yeah, saw another question about, is it normal to not feel like your old self after a stroke? And yeah, I mean, you're gonna feel differently because you're gonna have you might lose some independence, you might lose some abilities to it could be speech, or it could be movement. You know, it's gonna take a while to feel. You might never feel like your normal self. You might have a new normal. So
We've worked with many
Great
patients
time.
too, like
mhm,
don't have, the personal experience, but even just seeing different people. Sometimes it depends what it is too. Some people get even like depressed or something right after. Some people could be like months down.
mhm,
It all depends, but it's definitely good to get in a different group, to talk to different people or experience the same thing, maybe the same age group or the same things that you're missing. Because I feel like that's a huge part of
yeah.
it. Like, and everybody reacts differently. And
Mhm.
we've definitely seen a large array of stuff, but you're not going to feel exactly like yourself after, even if your stroke's not that severe. You're still going to probably have something that you're limited with that it can be hard. So it's
Mhm.
really good to have different people that you can talk to, even in
Yeah.
an online group if you don't want to go in person. Something, there's people
Hmm.
out there.
Yeah, so that's why what you're doing is incredible, because you're sharing all these great stories and different treatment ideas and all that. So we love that what you're doing, and I think it's like so helpful to that there are communities like this now and accounts that we can follow. If you're in the situation that you can, get motivated from and get the support that you need or are looking for.
Yeah. Oh, well, thank you. Yeah. I found you guys, I remember in the beginning, and I love the power of the internet because, before I was looking for stuff like this, and finding your content was one of them too. So yeah, I'm glad that I'm able to give back, and, we're doing it too, and providing information out there for people. I know I was looking for that. Yeah.
Well,
Well, thank you.
awesome. We're so happy that you found us and that we're able to help you. It's like we said, it's very refreshing to hear from someone who is benefiting from our exercises that's not a PT or OT. So, we love to hear that.
Oh, awesome. Yeah. Someone asked, should I be doing more repetition instead of strengthening to get arm to raise?
I mean, repetition is kind of strengthening too. If you're just moving your arm up and down, that's still using maybe like a lighter load. You still have the load of your arm. That's just doing more repetitions. It's more like an endurance way of strengthening.
Hmm.
Or using more load is more of like a muscle strength kind of way. And I think both are important.
Yeah.
In order to do prolonged activity, you do need to do repetitions.
Yeah, I think you can like switch it up to, add more weight one day and do less repetitions, which is fine. So it's just all about it's really focusing on the technique too. You want to make sure that you're doing the activity correctly and that you are activating the proper muscles, and that way it'll be more beneficial too.
Yeah, well, I love that. Yeah. I definitely feel like certain things, depending on, the extent of it too, and just if it's challenging to you, then yeah, even raising your arms, doing repetition, I think that is good. But yeah, I really appreciate your time. I know it's about 10:15 right now, and so, I do appreciate your time, and thank you for jumping on and giving out the information. Oh, wait, there's one more. Any tips for heel spurs?
I mean, a lot of times it might be your shoes too. I would definitely go check like some of
Hmm.
those stores too. I've done, well, I probably shouldn't say this. I went to one of those stores once and I tried on the shoes, but they're super expensive. I didn't
Oh
buy
yeah.
one pair from them. One of the next pairs I found somewhere else, but you could do it. But rest, you want to ice it too. Sometimes I take a little ball too, if that
Yeah.
helps.
Make
Like if
sure
I'm
you
in the
stretch
airport.
it, like stretch the like pull the toes back and stretch the arch. Yeah, and then make sure that you're not like overdoing it. Like if you're, make sure you're monitoring your activities. Are you standing for too long? Are you doing anything that's like worsening the symptoms? Kind of like maybe take like a note, write it in a notepad, like what's worsening the symptoms, and then you can kind of like readjust and modify from there.
Oh, good. Yeah, I do all that. I have this little like it's like a tennis ball, and I step on it every morning to kind of stretch out the ball of the foot.
Yeah.
I
Yeah.
used to take a little kid's bouncy ball. I actually
Hmm.
keep looking where mine is and I can't find it, like rolling my foot on it. It's really helpful. And even for a lot of things, sometimes back pain, any kind of pain sometimes comes from
Hmm.
the foot actually. So that little bouncy ball actually can do wonders. That was an
Oh
extra
yeah.
tip for me.
Yeah. I can see that. Well, thank you so much for sharing all the information. I loved it. Yeah.
Of course.
Yeah. Well, thank you for joining. I'm gonna post it on all the platforms so people can hear. And
Awesome.
yeah, I hope you have a good day. Thank you so much, girls.
Yeah. Thank
All
you.
right.
Here,
Take
nice
care.
to meet you.
Yeah.
Bye.
All right. Have a good
You
day.
too.
Bye, everyone.
Bye.